everyone, this is Jessica with Nearly Nested. Thank you so much for joining us for the Safe Sleep and SIDS Prevention webinar, where we're just going to talk about ways that you can reduce the risk for SIDS and other sleep-related causes of infant death for your baby. I am Jessica. I'm a registered nurse, a mama to a 5-year-old and a 3-year-old and one on the way, and she is due in August. I'm a high school sweetheart in life to this guy, a certified childbirth educator, and I am owner of Nearly Nested.
Hi, I'm Michael. I'm Jessica's husband. I'm her baby daddy, and I'm a board-certified pediatrician.
So objectives for today's webinar include discussing the evidence on sudden infant death syndrome, discussing the difference between SIDS and sudden unexpected infant deaths, and lastly, discuss ways that you as a parent or caregiver can decrease the risk for SIDS and other sleep-related causes of infant death for your baby. Now, this webinar is sponsored by Baby Bay, which we'll talk about in a little more detail later on, as well as Nearly Nested. As a new parent, one of my biggest anxieties I had was over SIDS. I would wake up so often throughout the night just checking on my babies to make sure that they were still breathing. And as medical professionals in peds and labor and delivery, we were taught all about SIDS and how important it was to teach prevention, to learn prevention, and just to educate our patients. So once I became a parent, those risk reduction measures I had learned about became one of the biggest strengths in my parenting game. And I remember the first time actually Michael experienced a SIDS case. He was in medical school and Tommy must have been maybe a month or two old. And he came home and he didn't really say anything. He just kind of took Tommy from me and went straight to our bedroom at the time. It was a shared nursery. He just sat there in our recliner or a rocker with him and just was holding him tightly and rocking back and forth. And he didn't even need to say anything. He didn't say anything, but I could tell by the way that he acted, that's what had happened or that's what he was experiencing in the emergency department that day. And I remember thinking like, oh my gosh, this is so real. And it was so scary and it was heartbreaking. But I knew from that moment on that we really needed to take those steps seriously to prevent that from ever occurring to our babies and the babies around us.
Yeah, so, SIDS and these SIDS-related, other sleep-related deaths are very, very real. They're heartbreaking. They really have such a huge impact on everyone involved. And, as healthcare providers, we try our best to protect all of our patients, to protect all the babies. But really, this is something where really all of the power is in the hands of the parents and the caregivers. And that's why it's so important for parents, caregivers, anyone who really plays any role in these babies' lives to learn about ways that they can prevent SIDS and learn all they can about safe sleep.
So what is SIDS?
So SIDS, S-I-D-S, it stands for Sudden Infant Death Syndrome, and it's a term applied to any sudden, unexpected, and unknown reason for the death of an infant, typically under the age of 1 and older than 1 month. It's the leading cause of infant death in that age group, so between 1 month and 1 year of age, and it's associated with sleeping. SIDS is not caused by suffocation, it's not caused by vaccines, it's not contagious, it's not the result of child abuse or caused by cribs or caused by choking. This is really an unexplained cause of infant death. We'll go over some of the things that can help prevent SIDS, but again, all of these things that we're talking about are not the cause of SIDS. We don't currently at this time understand and know what causes SIDS.
In 1991, actually, studies began to show an association between SIDS and stomach sleeping. But it wasn't until 1992 that putting a baby to sleep on his or her back was recommended. And from that point until 2010, safe sleep recommendations in education helped to drop the SIDS rate by more than 50%. So it goes to show you how effective these risk reduction measures or safe sleep measures are in really reducing SIDS. So you're like, Jessica, okay, so what is the cause? Well, here's the thing. Scientists don't know for sure what causes SIDS, but researchers believe there's a triple risk model, or there's 3 conditions that when you put them together can lead to an infant death from SIDS. So the first one is a vulnerable infant with brain abnormalities. So maybe a brain defect to the part of the brain that controls a baby's breathing or their heart rate, A baby with a healthy brain is a baby that will wake frequently throughout the night, maybe because it's too cold or too hot, or they're hungry, or they have caught a cold and can't really breathe really well. So they have those reflexes that allow them to kind of startle themselves awake. They have a sigh and startle reflex to clear their airways. And babies who are vulnerable don't always have that. So sometimes we even hear family members or friends asking if our babies are sleeping throughout the night yet. And most likely they're absolutely not. And that's completely normal. It's actually a protective factor that protects babies from SIDS. The second condition is the critical development period. So babies grow rapidly during the first 6 months of life. And with that are changes in bodies, heart rate, blood pressure, and body temperature. So sometimes you may hear someone say, my baby is so sweaty when they sleep. And that's because their body is growing so rapidly, especially with growth spurts that they have quite often. The last one are outside stressors. So while most babies can handle environmental stressors, such as like the weather or stomach sleeping or overheating, secondhand smoke or a common cold, a baby who's already vulnerable with a brain abnormality and undergoing a growth spurt may not be able to overcome them. So for example, if I had a vulnerable baby who was exposed to smoke, having too many layers on during a warm summer night and being placed on their stomach for sleep, that increases the risk of SIDS so much. So when you add 3 things together, these 3 conditions, that is what scientists believe leads to SIDS. So before we move on to what we can do to reduce the risk of SIDS, it's really important to realize that there's a whole other beast that we need to talk about. While SIDS is the leading cause of infant death, it's not the cause of every sudden infant death. So let's talk about SIDS, which is SUID. SIDS is actually an umbrella term to describe all infant deaths that are unexpected. Half of unexpected deaths are SIDS. So 43% of all SIDS are caused by SIDS.
Yeah, so as you can see here, and as Jessica mentioned, this SUID term is an umbrella term that encompasses sort of any unexpected infant death. And when it has a cause, an identifiable cause and reason that we can find that led to the child's death, then we can call it a SUID, but we can further go on to explain why. So it was either clear suffocation, entrapment, strangulation, a trauma, an infection, a disease, an ingestion, something that we can identify either in the history or an exam or laboratory testing or postmortem testing. Then we can call it what it is. When we have no answer for what happened, then it's a sudden infant death syndrome, or SIDS.
So if you're thinking like, okay, so what's the difference between suffocation, entrapment, and strangulation? Because we hear about that with accidents such as like the rock and play, or when babies, something happens to them when they're in the crib. So when we talk about suffocation, that is when the baby's airway is blocked and they cannot breathe. Entrapment is when the baby gets trapped between 2 objects, kind of like between a mattress and a wall. Or strangulation is when something wraps around the baby's neck and then it cuts off their airway. And so it's important to understand the difference between all of these when it comes to thinking about what we can do to reduce the risk for the babies. There are plenty of things we as parents can do to decrease our baby's risk for SIDS. But before we talk about those things, I want to make one thing clear. I can provide you with all the research and all the information out there, but ultimately, like Michael said before, the decision of how to care for your baby is up to you and your preferences. But with that said, it's really important to remember that the rate of SIDS has declined drastically, due in great part to safe sleeping solutions. So let's take a look at all of these. So let's talk about the do's of safe sleep recommendations. The first one is to maintain a healthy pregnancy. That includes going to regular prenatal visits, no smoking, alcohol, or drug use. And actually, Michael's going to talk a little bit about how smoking, alcohol, and drug use can affect babies' development in utero as well as out.
Each one of those things is a little different, but smoking, we can talk about that one first. So smoking while pregnant primarily affects your infant's growth, or your baby's growth while they're still in your uterus. But it actually goes on to affect growth even after they're born, even if you stopped smoking when they were born. So baby who was exposed to smoke while you were pregnant, even if you've quit and they've not been exposed after they're born, they still will experience some growth restriction. Alcohol is going to have developmental effects if used during pregnancy, and that can go on to anywhere from some mild behavioral or developmental delays to what we call fetal alcohol syndrome, which is a topic in and of itself. And then drug use of any kind is going to have a negative effect on your child, and that's really dependent on what kind of drug you're using. But honestly, any drug use during pregnancy is obviously not advised, harmful, dangerous, and not good for your baby.
The next one that we're going to talk about is placing your baby to sleep on his or her back. So make sure that everyone who watches your baby understands this as well. Infants who are used, or like say you teach them how to sleep on their back and they get used to it, but then they're placed on their stomachs to sleep at maybe a daycare or by a babysitter, are actually at a higher risk of SIDS and SUIDs in general than a baby that is always placed on their stomach for sleep. So that is so important. Once the baby is able to roll over on their own and rolls over during their sleep onto their tummy, it's okay. There's no need to reposition them. But it's when they are unable to do that, that maybe they accidentally do a little bit earlier, that is when it's really dangerous for them. Another common question that we get is, if I place my baby on his or her back to sleep, won't it cause a flat spot? There are two parts to this answer. The first is yes, flat spots can occur if the baby's in the same position for a longer period of time, but they're usually not harmful and will go away on their own once the baby starts rolling over and sitting up. And so a few things that you can do are to make sure that your baby gets plenty of supervised tummy time when they're awake. Limit the time spent in car seats. And actually, you can change the direction your baby lies in their crib. So say one day you put your baby's head at the left side of the crib, then maybe for the next sleep or nap, you can put the baby's head on the right side of the crib. Another question we get asked is my baby at higher risk for choking if he or she is placed on their back to sleep? And the answer for that is no, and I will show you right now. So if we take a look at this picture, we can see that the trachea, which is the tube that leads down to the lungs, is on the top or in the front part of the body, whereas the esophagus, which is the tube that leads down to the stomach, is behind it. So when they're placed on their back and say they spit up, there is less risk for, just because of gravity, for it to enter into the trachea tube. When the baby is sleeping on their stomach, you can see that this photo is flipped. If the baby aspirates and spit up comes up, there is a higher risk because of gravity that it will enter into the trachea and cause aspiration. So in fact, your baby is safer to be on their back during sleep versus on their stomach, even if they experience acid reflux. The next one is to use a firm, flat, safe mattress in a safety-approved crib. So what's a safety-approved crib? If you have a crib, go head over to the Consumer Product Safety Commission's website to check to see if your crib is safe and approved. There's actually a link on your handout that will take you straight to the website, and you can just type in the one that you have, and it'll, if anything was recalled, it will automatically pop up. You can also go onto their website and subscribe to receive recall information about all baby products. And actually, I received two today, one about a Target, baby booties, and another one, I can't remember what it was, but you receive them like daily if something was recalled. Recently, one of the most popular items, and an item that Michael and I had in our house for our baby, was recalled due to infant deaths, and it was the rock and play. And in items like that, or even like a swing or a car seat, the baby's head, once they fall asleep, has a tendency to just tilt forward, and this closes off their airway. Or if the baby somehow manages to roll over, say in a rock and play or their swing, and get stuck in that safety belt or like the side of the swing or rock and play, you can imagine how that would lead to suffocation or entrapment or even strangulation. And so sometimes we, as parents, often put them in there while we jump in the shower for 5 minutes, and we think they're sleeping, but it really only takes a few minutes for an accident to happen. So we always have to remember that. The next one is to breastfeed your baby. So guess what? Breastfed babies are at a lower risk for SIDS than babies who were never breastfed. So the longer you breastfeed, the lower the risk. Older generations were told to give the baby formula to help with the baby sleeping longer and deeper. And while there is truth in that breast milk is easily digested and absorbed so that the baby will kind of eat more frequently than a formula fed baby, like we said earlier, a baby who wakes frequently to eat is actually showing healthy behavior. But with that said, remember, if you're unable to breastfeed, that's okay. Remember, fed and healthy is best. But if you are able to breastfeed, it's important to remember that it's normal for your baby to eat more frequently at first. And actually, at first, the more that they breastfeed, the more your body is kind of stimulated to create more milk. So during nighttime feeds, if you bring your baby into your bed with you to nurse, make sure that you place him or her back in their separate sleeping area after. Evidence actually shows that the longer you bed share, the higher the risk of sleep-related deaths. So definitely try to create a separate, safe sleeping area for your baby that's right next to you. And I know you're probably thinking, okay, Jessica, but what if I'm exhausted and it's like 3 o'clock in the morning and I accidentally fall asleep while nursing? So let me tell you this, been there. It is less dangerous for you to accidentally fall asleep nursing in your bed with pillows and blankets moved away than if you accidentally fall asleep nursing your baby in your rocking chair, a regular chair, or on a couch. So if you notice before feeding your baby that you're just absolutely exhausted, avoid the rocker or the sofa. Just remove all the soft items and bedding from your bed before nursing your baby. Lay on your side and you can side nurse your baby. And if you accidentally fall asleep, you'll know that your baby is safe. There's no risk of suffocation with pillows or strangulation or entrapment or anything like that. So just take those precautions.
And a couple things with that. So obviously, if you have a partner or a spouse, utilize them in those situations as well. They can't feed if you're breastfeeding the baby, but they can change a diaper, they can put the baby back to bed, they can be in charge of that. They can wake you up if you fall asleep. And if you don't, or if they're not there, actually setting a timer on your phone, half an hour, 45 minutes from the start of your feed, could be a possible, sort of safeguard to you falling asleep with your baby and waking you up and reminding you. So next is share your room with your baby for at least 6 months to 1 year. And this, to be explicit, is sharing a room and not sharing a bed. So this is room sharing, not bed sharing. There's no evidence for or against any devices or products that claim to make bed sharing safer. Nothing that goes in your bed or on you or really anything that is going to make that safe. But keeping baby in your room, we actually know can be protective against the things that we've been talking about.
And as a parent myself, I can attest to the struggle of sleep deprivation and knowing that bringing my baby into my bed feels like it can make life so much easier for you. But it's also important to remember that that risk remains there for your baby. And I know with both of my littles, I had the strongest intuition to keep my baby with me, but it went against everything that I had ever learned about safe sleep and SIDS prevention as a nurse and him as a doctor. So now, even with our two little ones that crawl into our bed in the middle of the night and are quite violent sleepers, I realize how important it is for this next one to have a safe and separate sleeping area to prevent any sort of strangulation, entrapment, or suffocation, not only just from Michael or I, but even from the other kids as well. Just to add on to that, I'm going to be doing another video at the end of this month for a product called Baby Bay that we are actually choosing for our third baby because of all the reasons that I just mentioned. It's actually a crib, it's bedside sleeper that it attaches to your bed, but allows your baby to stay at your side for easy access, and especially when breastfeeding. But it's a safe and separate sleeping area. It has like this little wooden slat that divides its crib from our bed. And so it really reduces, if not eliminates, the risk of entrapment for that. And I just feel so much more at ease and a little bit more confident that I'll be able to do this breastfeeding thing, manage the other two kids, but also keep this baby close and be able just to watch her, which is what my intuition always tells me to do. It's also CPSC approved, and I'm going to attach a link to this in the comments, but also you'll have that in your handout. The next one we're going to talk about is
using a pacifier for sleep. So this is actually something that research has shown to be effective and reduces the risk of sleep-related deaths, all sleep-related deaths, including SIDS, by 30%. And this has been shown that pacifiers used primarily when putting the baby to sleep is most effective at reducing this risk. So you can put a pacifier in to help calm the baby, to help put the baby to sleep. If it comes out, you don't need to worry about continuously putting the pacifier back in. And you don't really need to worry about this interfering with breastfeeding. You don't have to wait for breastfeeding to be fully established before using a pacifier. You can use a pacifier right away. There's good evidence and research to show that it will not hinder your breastfeeding.
the next one we're going to talk about is taking your baby to regular checkups and follow recommended vaccine schedules. So there's a common argument that vaccines increase the risk of SIDS. And as a parent, if I heard this without knowing any of the things that, we researched or looking into the research myself or actually the hard evidence, I would be completely frightened by it. And I totally understand the fear that follows that. But it might ease your mind to know that there's actually no evidence that childhood vaccinations increase the risk of SIDS. Although there are anecdotal reports of infants dying within a few days or weeks of being vaccinated. And this is mostly because infants in the age range at risk for SIDS are also getting the routine vaccines, right?
Correct. Yeah. So in the first 9 months of life, babies are getting vaccines at least every couple of months. The typical schedule is at 2 months, 4 months, 6 months, 9 months, 1 year. And some people actually choose to spread that out. So they might even be getting shots for vaccines more frequently. That doesn't mean that they're causing, and some of these babies will unfortunately die from SIDS. But it doesn't mean that just because they had a vaccine sometime within the last couple of days or a week or so, that caused anything that happened to them, that it caused SIDS. It just happens to be temporarily associated with it because it's something that happens so frequently in terms of getting vaccines and something that happens to all babies. And if you look back, you probably find a lot of other temporally related events that happen in that baby's life that happens to all babies. That doesn't mean that they're causing the SIDS.
Yeah. And so the number of cases of SIDS has fallen by more than 50% since the mid-1980s, whereas the number of vaccines administered just continue to rise. So just take a deep breath and know that these vaccines they won't lead to SIDS. Unfortunately, like Michael explained, it is very common for a baby who has died from SIDS to have had a vaccine in the past days, weeks, or even a month. But it doesn't always mean that those vaccines, or it doesn't usually mean that the vaccine or anything that happened within those months, days, weeks, whatever, had led to SIDS. So the last one we're going to talk about is supervised tummy time when awake. So tummy time is so important for helping develop your baby's neck, shoulders, and arm muscles. And we kind of explained that earlier to help your baby, with the flat spots, but also to increase those muscles to help them roll back over. And there's so many ways that you can do tummy time.
Yeah, I mean, tummy time from the first day of baby's life is important, and that even means putting baby on your chest, spending time with them, skin to skin time. Of course, we want to see as much tummy time on a flat, level surface as well while they're supervised. But any time that you can get baby off their back while they're awake, while they're being supervised, is going to be helpful for their development, for their sensory and neurologic development, as well as for rounding out their heads and any flat spots that may come about.
Yeah, so maybe even like when the baby's born or anytime you're in the hospital or at home, there's any downtime and they're awake, just do skin to skin, have the baby on, your chest, allow them to look back and forth and try and get in all those sounds, to look around, to take in everything. And that counts as tummy time, and that has so many benefits for your baby. So the sooner you practice that, the better.
Just remember the floor is also a potentially hazardous place for the baby, so make sure it's safe,
Yes.
Free of anything that might be dangerous. You're watching them for incoming pets, other children, anything dangerous on the floor.
Good idea. I didn't even think about that one. So now let's talk about the don'ts. So the first one is do not place soft objects in or around the sleeping baby area. So this includes blankets, stuffed animals, pacifiers with stuffed animals in the crib with the baby, or even anywhere near the baby's sleeping area. This will decrease the risk of suffocation. So instead of using blankets, maybe you can use a sleep sack for colder weather, or maybe thicker onesies, but try to avoid blankets or even like loose swaddles, because the more that the baby moves, the more they can, loosen up. And that can totally lead to strangulation. And even, just allowing the baby to use its natural reflexes. It's also important to not use bumpers on safety approved cribs for the same exact reason. So any sort of bumpers, whether they're mesh, whether they're plush, whether they're like just bumpers, it's really important to just keep everything out of the baby's area. It should just be really just the mattress with the sheet on top for the baby, a fitted sheet, I should say. They do have tons of sleep sacks, tons of zip up, like sleeping bags. You can use swaddles or like the sleeping swaddles at Velcro, kind of have a loose bottom, kind of like a sleeping bag type thing. But once they are starting to roll over, it is recommended that you stop swaddling their arms and kind of allow them to be free so that if they do roll over, they can push themselves back. The next one is, do not place a baby to sleep on a couch, your soft bed, on pillows, sheepskin, or even a soft blanket. So why is this even important? It's because it helps prevent suffocation and entrapment. There are so many products on the market today that have bumpers or pillow top softness that claim to promote infant comfort and sleep. But the soft top and bumpers can place an infant at risk for suffocation and or entrapment. The next one is to avoid products that go against safe sleep recommendations. And that will include everything that we just talked about, like the pacifier with, a stuffed animal at the end, or any of those pacifier leashes, or, big blankets, or anything like that. Avoid heart or breathing monitors.
Yeah, so there's no products on the market that has been shown to be able to prevent SIDS from happening. So any of these sort of home baby monitors, the commercial ones that you can buy anywhere over the internet, really they may claim that they can help prevent this, but there's really nothing that's been shown to prevent it. They do, however, offer a lot of problems. They can offer, one, a false sense of actual assurance, so you can sort of rely on these monitors, although they're not, like I said, not going to prevent anything from happening. They can have normal numbers, and unfortunately, these children can still experience SIDS. But really, they can also have the opposite effect, and they can have completely erroneous numbers, which have nothing to do with what's actually happening with the baby. They can have various alarms that keep you up at night for no reason. They can constantly keep you on edge. They can lead to sleep deprivation, irritation. I mean, as medical professionals, we know all about alarm fatigue and dinging and monitoring and worrying about numbers.
Yes.
And there's no reason for you to bring that into the home for your baby. Now, some babies get sent home with these things. Some people have these things actually prescribed and given to them by doctors. These are medical grade equipment with children who have a medical need for some of these monitors, and that's a completely different story. That's all in the hands of your doctor. But these commercial products that you can buy for your baby yourself, really, there's really no reason to have.
The next one is, do not smoke or allow any sort of smoke near your baby. So this includes, during pregnancy as well, like we stated earlier, but studies have shown that women who smoke during pregnancy or merely are around smoke can contribute to asthma in children along with other issues. This even includes secondhand smoke, thirdhand smoke, whatever hand smoke you want to call it, that lives on other people. So that includes like your spouse or your partner or, babysitter or a grandparent or a visitor. Sometimes we think it's okay for them, to smoke outside, but as long as, they're not smoking around the baby, that it's okay for them to hold or to care for our baby. But that secondhand smoke is equally as dangerous to babies as them smoking inside the house.
Correct. Yeah. So I mean, any smoke exposure for a baby is harmful, and we already discussed this. While you're pregnant, after the baby's born, none of it's good. Second, third, fourth, fifth, however many hand smoke you want to try and think of, none of it is good. All of it is bad. Preventing it as much as possible. And this is really, people stand up for their children for lots of different reasons and try to keep their children as safe as possible. I don't, however, see it that often with smoke, and I think that that's something parents should feel empowered to stand up for the safety of their children about, and asking people who smoke, not to come near the children, change clothes, stop smoking. These are really, really, really important things. These are things that have actually been shown to be harmful and things that we really need to be vigilant about.
Yeah, and I can attest, when I worked in pediatrics, and I know Michael can say the same thing, is that when you see babies or young children with asthma exacerbations, a lot of the time, if they have family members that smoke, it's in large part due to that. So definitely take that seriously. And as Michael said, feel empowered. Tell people to stop smoking. Not only are you saving their lives, but you're saving your baby's life. And if you are a smoker, or you are, you're a care provider, maybe you're not the parent, congratulations. Today is going to be your last day of smoking.
And this is actually something that, unknown to parents, though, that pediatricians can actually, and, family medicine doctors or whoever's helping care for your child could be very, very helpful in getting you or your spouse or partner to help stop smoking. So bring it up with your child's care provider, and they'd be happy to either provide you with resources or actually, provide you with medications to help get you gums, patches, whatever you need to try and help stop smoking.
I didn't even know that. Thank you, Michael. Wow. Learn something new every day. Okay. And the last one is, do not let your baby get too hot during sleep. I keep referring to the older generation, and that's just because it's a lot of culture norms and things that were passed down to them. And as we spoke about earlier, all these safe SIDS or safe sleep prevention and risk reduction practices didn't come out until actually like 1990s. So everyone before then were told different and various things. But our older generation and certain cultures definitely believe that you always have to keep a baby bundled up with a blanket, a hat, socks, and fleece pajamas. But it's important to dress your baby appropriately for the environment. So sometimes, like right now, we're in San Diego and it's pretty warm. Our windows are open, the fans are on while we're sleeping. We're all in shorts and tank tops just to be comfortable. And it's important to remember that if we're hot, your baby is most likely hot too. They run around the same temperature as you are. And Michael was actually telling me before that recommendations are now just to keep the temperature at like ambient temperature. So that's like 70 to 72. Is that what you said?
Mm-hmm.
So definitely dress your baby appropriately for the environment. Dress them to how you're feeling. If you're feeling cold, definitely put an extra layer on the baby. But if you're hot and it's a warm summer night, maybe just a light cotton pajama to keep them asleep. If you want to put a sleep sack on them, definitely look for something that's not so dense, very light, that is breathable. I know people have raved about bamboo swaddles or blankets to help regulate temperature, but it's very, very, very important that you regulate your baby's temperature and keep checking them. Keep the baby's head and face uncovered during sleep. Not only does it increase their heat, but it can also, go in front of their faces or cover their faces and decrease or inhibit their breathing. Their head is one of the main ways that they get rid of heat. So definitely keep that uncovered during warm nights or even just every night. Avoid over swaddling the baby. Let's see. And a great way to make sure that the baby is not overheating is really just to place your hand on their chest. Make sure that they're not sweating. But if their chest feels super hot, like they're feverish, you need to take off some layers right away.
The hat thing, yeah, definitely, unless it's really cold, no need for that hat on the baby. However, in the immediate newborn period in the hospital, totally fine for that baby to wear that hospital given little beanie. Another thing is, a lot of people have said the best way to think about dressing your child is to look at whatever you're wearing and then to add one extra light layer to that. The only thing I would say about that is, just keep in mind that if you're wearing a parka and a beanie, but everyone else in the house seems to be comfortable in some shorts and a t-shirt, then maybe just go with whatever the average is in the house. Because I know even amongst us, there's some pretty different temperature regulations.
Yes,
so
this is true.
Just, your baby doesn't always have the same temperature regulation as.
Thank you. And so to summarize all of these, there currently is no way to prevent SIDS, but when looking at the 3 conditions that put a baby at risk for SIDS, which if you can remember were the vulnerable baby, plus a critical development period, plus an outside stressor, we can see that there certainly is room for us as parents to help decrease those outside stressors and therefore decrease the risks for that. And not only decreasing the risk for SIDS, but for SIDS in general. So follow safe sleep recommendations to decrease sleep-related deaths. And if you're ever in doubt, visit the cpsc.gov website, which is the Consumer Product Safety Commission, to check to see if your crib is safety approved or any of your baby items are safety approved or if they've been recalled. And remember to stay tuned for upcoming Baby Bay bedside sleeper video and blog regarding safe sleep for parents who want to keep their babies close. This is what we've chosen to do. And we've done a lot of research on it. I've called and spoken to them and just gotten a lot of information. And we just want to make sure that we can provide a safe sleeping environment for this baby as well. So now to conclude our webinar, if you think of any questions, you can email me at jessicahasboon.rn@gmail.com. And this webinar will be posted on nearlynested.com and my YouTube channel for future reference and for you to lovingly send to grandparents, other family members, or to friends or anyone who's going to watch your baby. But like I said, if any questions come up, please feel free to email me or send me a direct message, and I'll make sure to get you all the information that I have. So that's it for today. I hope this was helpful and that you feel empowered to provide a safe sleep environment for your new baby. Big hugs to everyone. Bye.